Breast augmentation surgery appeals to a wide range of ages because you can have someone that's just out of high school and they've always wanted to have augmentation surgery because they're self-conscious because they're smaller and in changing rooms and things they just feel self-conscious. And then you can have moms that have gone through having a couple babies and they feel like their breasts have deflated, don't look the same as they used to. And then you've even had some patients who have had augmentations before, but now it's time to change the implants and they're in their 50s on up. So I've done augmentations in women from as young as 17 because with parents' consent to as old as 75. So it's a wide range of patients. Primary breast augmentation, that is the first time a woman's having an augmentation, is done at a surgical center. And I operate at 2 surgical centers currently. One is at the Utah Surgical Center and then Intermountain Surgical Center as part of that larger campus. As far as revision surgeries can be pretty simple on occasion. Some patients will come to me and either not happy with their augmentation done elsewhere, either the implants are too large, too small, positioned not to their liking, their cleavage may not be to their liking, and it's pretty simple to block the perimeter of the breast, and in my procedure room give them a light sedative by mouth and remove their scar and temporarily remove the implant without any pain, modify the pocket more or less where the implant lives so that it can dramatically change the appearance of their breast with a much smaller cost to them. It's really patient dependent. It depends on how thin they are. If they're very thin, you want to have a gel. If they go with a silicone gel, that's more cohesive, so it doesn't ripple or fold or have small dimpling that's apparent through a thin skin coverage. So that there's really different cohesivities of silicone now. Really, there's almost 4 different types, from a very soft silicone to a full, what some patients will refer to as a gummy bear type implant. Well, breast augmentation, again, the definition is to essentially augment or increase the size of the breast. So we've talked about implants. There's anything from a traditional saline implant to silicone implants. There's many different forms of silicone implants. But also another form of augmentation is natural augmentation with one's fat, their own fat. A lot of patients ask questions about this, and that's why I think it's important to mention. I can liposuction an area of the body, I can prepare the fat and then transfer it to the breast, but there you get a much more subtle or modest result. What I tell patients is they will get a 1 cup size difference. So if they're a B cup, they'll be a C cup. But a lot of patients coming in for augmentation are an A or B cup and they want to go up 2 and 3 sizes. So fat transfer can't accomplish that with 1 surgery. You can accomplish it with 2 to 3 surgeries, each time letting the fat graft in and then repeat the surgery. Recovery, we've really kind of refined in plastic surgery how to make the recovery a little quicker. We found that if we don't have to really touch or have much contact with the rib surface, then patients have a lot less pain. And so we're mindful of that. And also if we try to treat muscle spasm or tightness after surgery, because most of the implants are underneath the muscle, then patients will have a lot less pain. And also pain, a big factor to that is consciously being aware of your recovery. So if we can distract patients, then they have less pain. So we have lots of new protocols where I encourage patients to go out to dinner, movie the same night of surgery because they'll have a lot less pain. Now this is a surgery where I make sure I tell patients that it's not their first, it will not be their last surgery. So it's going to require some maintenance because it is a foreign object within the body and it's not meant to be permanent. And even if they were to read the FDA guidelines, it's not permanent, and there's some recommendations as far as how to have some normal surveillance is that the implant's doing fine. On average, most patients will have a revision surgery every 10 to 15 years. Some patients will have surgery sooner because they desire to have a larger implant or smaller implant. Life changes. But most commonly every 10 to 15 years, it's most of the time to modify the scar that's around the implant. That scar can get tight and it can change the shape of the breast. It's a very high satisfaction type surgery. I've really not seen patients where they regret their choice, at least to date. It allows them, and a lot of women, if you look at their hip circumference around their hip, their waist, and then the woman has a smaller breast, there's a lot of clothing out there that just doesn't fit right. They can bend over, pick something off the ground, and they honestly have to kind of hold a hand over their chest because it doesn't fit right. So if they even go with a small, modest implant, then their breast kind of fits their body shape and clothing fits better. And so I think it helps their self-esteem to have some volume in their breast.